Hi, welcome to this training video for the corpuls CPR arm. First, let's look at the outside of the bag. So on the back of the bag here, we've got our backpack straps, a shoulder strap and a carry handle. On the side of the bag, we have a flap here that enables us to charge the device whilst it's stored in the bag, and we have a viewing window so that we can see how much charge is in the battery. The front pocket contains the quad board, which is for in-hospital use. And then if we unzip the bag, we have individual compartments for all the different components. So we have the arm itself, charging cables, a spare battery. There is already a battery in the device as well. And in the last compartment, we have two stamps. The smaller stamp is for chest sizes from 20 to 34 centimetres deep, and the larger stamp is for chest sizes from 14 to 28 centimetres. So here we have a patient in cardiac arrest. I now need to bring in the CPR arm so that we can replace Pete's manual compressions with mechanical compressions. First, I need to get the board out of the bag and pop it onto the patient. This is the radiolucent quad board. We need to pay particular attention to where this part of the board goes, as this is the socket that the arm will drop into. It can go anywhere around the patient. We just need to pay attention to where interventions might be happening. So Pete, in a second, we're going to log roll the patient. I'm going to slide the board underneath. Can you count me in, please?
28, 29, 30.
In a real life scenario, we would be continuing with manual CPR at this point whilst we get the rest of the device ready. So I'm going to unzip the bag and remove the CPR arm, powering the device on as I do so. The switch is underneath so that we can't accidentally press it. So once the device has been switched on, it will do a quick self-check, and then we just need to have a little look at the settings to make sure they're appropriate for our patient. So in this case, we've got a compression depth of 5.5 centimetres and a compression rate of 100 per minute. So now we need to position the arm into the socket of the board. To do this, we're just going to align the two, and the weight of the device, we'll just let it drop down into the board. Note that I've got the stamp positioned away from the patient. This is to allow manual CPR to continue until we're fully ready with the device. So now we need to make sure we have the correct stamp for our patient. So to remove this one, I'm just going to pull down. Usually you'll find that the shorter stamp is appropriate for most adult patients. However, because we're using the mannequin, I'm going to swap it for the longer stamp. And to pop it in, I just have to push upwards. When you pack the arm away, store it with the small stamp attached. Now we need to position the stamp on the lower third of the patient's sternum. To do this, I'm going to lift the lever using 2 fingers. That unlocks the arm and allows me to move it up and down, bend at the pivot joint, and move on the horizontal plane 360 degrees. So I'm just going to bring that in now and angle it appropriately. So now we're watching this light as we want to make sure we've got the correct vertical position of the stamp. Ideally, we want this light to be green, so I'm just going to push the device down a little bit. However, if we go a bit too far and get the red light, it means we've got too much pressure on the patient's chest, so we need to let it come back up a little bit. If a red light is showing, you will not be able to start the device. So green is good, but if we come up a little bit more and we happen to be at amber, that's fine as well, as long as we can see that the stamp is touching the patient's chest. So now I'm just going to close the lever and press go. After pressing the therapy button, it will take 4 compressions for the device to reach the maximum compression depth. When in 30 to 2 or 15 to 2 mode, the blue light will indicate a ventilation pause. You'll know this is coming from the audible alerts beforehand. In continuous mode, the ventilation indicator is configurable and the default setting is 10 breaths a minute. So the screen is split into 4 quadrants. In this top corner, we can change the mode. We're currently in 30 to 2. But if we press the button and then go up with the arrows and press the tick, we can change it to 15 to 2, which would usually be used for pediatrics. Or we can press the soft key again and go to continuous and press the tick to confirm, and that would normally be used for a patient with a secure airway. The other side at the top alternates between the current time and the time that the device has been running, and also shows the amount of time left in the battery. At the bottom here, we can use the soft keys to change the depth of compression. We press and then we use the plus and minus to increase or decrease the depth. We can do this without having to press any tick to confirm, and we can do it while the device is in use. And then on the other side, we can do the same for the compression rate. So again, I can use the plus and minus arrows to increase or decrease the compression rate, and we don't need to confirm. The 2 keys at either side can be used to either change the colours of the screen or flip the screen to face the other way. So if I press these 2 together, we can change the direction of the screen, and if I press these 2 together, we can change the colour of the screen. To improve cardiac output, you might want to just reposition the stamp ever so slightly to find the sweet spot. To do this, simply press the therapy button, lift the lever, adjust the stamp ever so slightly, close the lever again, and press start again. At the end of a 2-minute CPR cycle, you'll need to pause the device in order to do a rhythm check. To do that, simply press the therapy button. At this point, if you find you have a shockable rhythm, restart the device whilst your defibrillator is charging. Once your defibrillator is charged, pause therapy, shock the patient, and restart. If you find you have a non-shockable rhythm, of course you would just restart therapy and begin another 2-minute CPR cycle. If ROSC is achieved, lift the lever, move the arm away from the patient and return to its lowest position. Leave it set up in case you need to use it again. If an alarm is triggered, you can either suspend it by pressing this soft key. An alarm can be suspended for up to 120 seconds, or you can acknowledge by pressing the tick soft key. Here are the alarm priorities for the CPR arm and their possible meanings. The therapy button will display the corresponding alarm priority colour as indicated on the chart. Please take a moment to familiarise yourself with them. In addition, this table displays the most common alarm notifications on the CPR arm and how to deal with them. Your device will come with 2 batteries, one that's already attached and a spare in the bag. Each battery will have a running time of between 90 and 120 minutes, dependent on your parameter settings. If you do need to change the battery at any point, your device will give you a warning 15 minutes in advance. Then simply press the 2 red buttons on the battery, remove from the device and immediately replace with a new battery. You will then have to press start. If you do this within 30 seconds, the device will retain the parameter settings. If you need to check the remaining power on your spare battery, simply press this button. The device can be powered from the mains using the magnetic charger. It comes in 2 parts, so you just want to make sure that you've got both in the bag. Connect the magnetic part of the charger at the base of the arm. It will take about 2 hours for a fully depleted battery to charge up, but you can use the device whilst you're charging as long as you have a battery in situ. After use, you will need to clean and disinfect your device before you pack it away in the bag. To do this, first of all, switch off the device and disconnect from the mains. You can then lift the lever and extend the arm to its full height. Close the lever down again. Now take out the stamp by simply pulling down on it. Now what we want to do is take a damp cloth to remove any visible signs of dirt or soiling on the device, make sure you cover all surfaces. And then we can follow this procedure with our disinfectant wipes. A list of suitable disinfectants will be found on the screen now and can also be found on the Ortus Knowledge Hub. So once we've done this, we can make sure we leave plenty of time to dry before we pack it into the bag. For accessories, you will follow the same procedure again. So first clean with the damp cloth and then use a disinfectant wipe. We can take this opportunity to check our accessories for damage. So for example, on the stamps, these are suitable for up to 50 arrests. All we need to do is make sure we can't see any signs of stress to the plastic. It's essential that daily checks are conducted to ensure the device and accessories are in good working order. It's recommended that function checks take place daily or per shift, after use and as required. You can download this checklist from the Ortus Knowledge Hub. So now let's put that all together. Obviously, for the purposes of demonstration, this isn't going to be quite full speed, as I'm going to give you some prompts as we go through again. So first, we're going to put the board underneath. So Pete, we're going to log roll the patient. If you can count me down, please.
28, 29, 30.
Thank you. And continue CPR while we get the arm ready. We're going to take the device out of the bag and switch it on as we do so. Going to have a quick check on the screen to make sure my parameters are correct and drop the arm into the socket with the stamp away from the patient. We're going to check we've got the correct stamp. So I'm changing it now again because we're using the mannequin, and then we're going to lift the lever and swing the arm round. And then again, Pete, when you're ready, I'm going to bring the arm over the patient's chest. So if you count me down.
30.
Perfect. Down to green or amber, slap the lever down and press go.